Topping your news first tonight with FestPac just around the corner and with the knowledge that the Zika virus is present in some Pacific Island nations, is Guam prepared to host some 13,000 visitors this summer? That is what a FestPac organizational committee discussed during a planning meeting today with several government stakeholders, including the Department of Public Health. Zika test kits seem to be one of the primary focuses of a FestPac organizational meeting at Adelup today. The rapid response test kits will be able to test an individual for the presence of the Zika virus, a mosquito-borne illness that is now linked to certain birth defects in unborn babies.
We hope to get within the next couple of days an answer from CDC back in Atlanta in regards to whether those kits will be coming in.
Public health advisor for the Centers for Disease Control on Guam, Peter Jadikpa, says as of right now, there is no way to get immediate results for testing of the Zika virus.
The interim doesn't mean that you're not without a fallback, and the fallback is that currently Hawaii State Lab is the identified lab to process all Zika specimens that are suspect case specimens that are collected here. The only thing, though, is that unlike the rapid response test kits, this would take at least about a 48-hour turnaround time.
Although there are no signs of Zika being present on Guam at this point, that possibility was discussed in light of the upcoming Festival of the Pacific Arts this summer. The event is expected to draw in over 13,000 visitors to the island, some of whom will come from countries that are endemic to the Zika virus, such as Yap, French Polynesia, and American Samoa.
I think if there is anything fortunate about the Zika virus, is that the mortality rate is low. So it's not like Ebola where everyone is scared and as soon as you get it, we need to know real quick so we know how to treat you. But the purpose is determined, especially if the danger for us right now as a public health emergency of international concern is the unborn child.
FestPac Festival Director Rose Ramsey took the discussion a step further. What happens if someone on Guam tests positive for Zika, whether a visitor or a resident?
Do we have a contingency plan? Should a Zika, should someone be infected with the virus? What is the next step?
Sure.
We'll be ready.
You'll be ready. So you're just kind of like putting that plan together, right?
Right.
How are we going to address?
Sure. A major partner that I don't see at the table right now, Ms. Ramsey, is Guam Memorial Hospital. If there's going to be any ground zero for folks being brought in for symptoms, and especially if it's a visitor from the delegates there who chances are won't go to a private clinic.
We'll be ready well before that. Okay, the key is going to be getting the kits on time and enough of them. You have to beat the pan, right, to make sure they remember we're out here. Okay, and that's the key, and that remind them that we're going to have 13,000 some odd people visiting us starting in May, some from Zika endemic countries, and we got to be ready.